Hi, I'm Naomi Patel. I'm a rheumatologist at Massachusetts General Hospital in Boston, Massachusetts, and I'm the Associate Director of the Rheumatology Vasculitis Program. ANCA-associated vasculitis encompasses a couple of different diagnoses. There are forms of small vessel vasculitis that cause destructive inflammation of the small and sometimes medium blood vessels. And they have a predilection for pulmonary and renal involvement, but they can really involve a whole variety of different organ systems. The role of complement in the disease has been increasingly recognized over recent years. And Avacopan is a recently identified medication that was FDA approved in 2021 that's a C5a receptor inhibitor and was shown to significantly reduce glucocorticoid exposure in the induction of remission in this disease. So at Mass General Hospital, we have a cohort of individuals with ANCA-associated vasculitis, particularly GPA and MPA, all of whom have been prescribed Avacopan. And so we've gone back to do retrospective chart reviews in detail of anyone with ANCA-associated vasculitis in our system to determine what treatments they received and whether Avacopan was part of that regimen. So we follow people actually and collect data for the 12 months prior to their Avacopan prescription and the 12 months following their Avacopan prescription to really obtain comprehensive data regarding their diagnosis, treatment, laboratory values, vital signs, glucocorticoid exposure, and a variety of other factors during this time frame. The primary outcome that we looked at in one of our studies that was presented at ACR was sustained remission, which was the same definition that was used in the Advocate trial. We included this definition, which included a combination of requiring remission at 6 months, which meant a BVAS score of 0 and no steroid use for either GPA or MPA in the month prior, as well as remission at 12 months, which required a BVAS score at 12 months and no steroid use for GPA or MPA within the month prior to that, as well as no relapse in the 6 to 12 months following prescription. And so it was a fairly stringent definition. We also looked at a variety of other outcomes in terms of relapses, glucocorticoid exposure, BVAS scores, dialysis use. And then for the data that we presented at ASN, we looked at a specific subset of individuals with renal involvement from AAV, and we looked at renal specific outcomes, so changes in eGFR, proteinuria, urine protein creatinine ratio, dialysis use, and other factors. So we looked at glucocorticoid exposure in the 1 year prior to prescription. And we also looked at treatment options that people were on both at the time of Avacopan prescription as well as in the 12 months prior in terms of specifically medications like B-cell depletion with rituximab or other CDN20 inhibitors, because those medications have durations that last for many months and sometimes even up to a year. So we assessed the glucocorticoid exposure in the 3 months prior to Avacopan prescription and found that people received a median of over 1 gram of glucocorticoids just in the 3 months prior to prescription. And in the 12 months prior to prescription, people received about 2.3 grams in terms of their median glucocorticoid exposure. And this is measured in prednisone equivalent milligrams. In terms of the concomitant treatment, about half of individuals had received rituximab as part of their remission induction therapy. And in our cohort, almost a third of individuals received treatment with a combination of rituximab and cyclophosphamide, which is different than what was used in the Advocate trial. A minority, so only several percent of people received treatment with an oral conventional synthetic DMARD, and also a small minority, so several percent, were not receiving any concomitant treatment aside from Avacopan and the glucocorticoids they were using. In terms of our overall results, we assessed outcomes at 12 months among the subset of individuals who were prescribed Avacopan, initiated Avacopan, and among those who had complete 12-month follow-up data and who are still alive at 12 months. So that sample size in our study of those presented at ACR was 95 individuals. And in that subgroup, we found that 64% were in remission at 6 months. So again, this is a BVAS score of 0 and no steroid use for GPA or MPA in the month prior. and 61% in total had sustained remission at month 12. We found that a substantial majority, so 87% of individuals were glucocorticoid free at month 12. And almost all, so 95% had a BVAS score of 0, meaning clinical remission. A minority of individuals, so only 3 overall, had relapses. And this was between months 6 and 12. Only one of these was major and 2 were minor. And that was defined by BVAS score of less than 3, absence of major criteria for the minor flare definition. We found reassuring data in terms of the glucocorticoid use throughout the 12-month follow-up period. So we found a cumulative prednisone equivalent glucocorticoid exposure over the initiation period to month 12 of around 1 gram. And we found a median time to glucocorticoid discontinuation among those who are off of glucocorticoids of 84 days. And so while this is greater than most individuals in the Avacopan arm of the Advocate trial, it's substantially less than most of the glucocorticoid tapers that have been used historically for the induction of remission treatment in AAV. In terms of the Avacopan data, we found that 57 out of 95 people had discontinued Avacopan by month 12. There's a substantial variety of practices, and there's no clear consensus right now on the optimal duration of Avacopan use. Among those who had discontinued by month 12, we found a median time to discontinuation of Avacopan of 203 days. And most of the reasons for discontinuation, the most common reason included that the planned course was completed. However, that was defined by the treating physician. A minority of people experienced adverse events in terms of aminotransferase elevation. We only saw in 5% of individuals. And other adverse events were very variable in terms of things like hair loss, GI upset, all seen in a significant minority of individuals. The other thing to highlight from this study is data regarding the glucocorticoid toxicity. So we used the glucocorticoid toxicity index metabolic domains to measure change in glucocorticoid toxicity between initiation, which was Avacopan initiation, and month 12. And this is a subset of the overall glucocorticoid toxicity index, or we call it the GTI, that includes the blood pressure, body mass index, lipid metabolism, and glucose tolerance domains. We looked specifically at individuals who had worsening in any of those domains between initiation and month 12, and found a substantial minority of individuals in the glucose tolerance domain, so only 5% had worsening, 18% in the lipids domain, and 21% in the body mass index domain. A higher percentage, so 41%, had worsening in the blood pressure domain, although similarly, as we've seen in the Advocate trial, this one's difficult to interpret in individuals with AAV because renal involvement and hence blood pressure control can be a significant manifestation of the disease itself and not just of glucocorticoid-related toxicity. So among the subset of individuals with renal involvement and 12-month follow-up data, which was 54 individuals of this cohort, we found meaningful increases in the estimated glomerular filtration rate. So an increase from 32 as a median at baseline to 44 at 12 months. And we also found meaningful reductions in the urine protein creatinine ratio from a median of 1.1 at baseline, which represents over 1,000 milligrams of protein in the urine, to 0.3 at 12-month follow-up. We also found very reassuring data in this cohort in terms of dialysis use, both at baseline and follow-up. There were 7 individuals who were receiving dialysis at the start of the study at the time of Avacopan initiation. And of those, 6 of them, so 86%, were dialysis-free at 12 months. One of the overall takeaways of this cohort so far for us is that the data and the outcomes really reinforce the effectiveness profile of Avacopan in a real-world cohort of individuals with GPA and MPA, and a minority discontinued Avacopan due to any adverse events or safety-related issues. These data are overall on par with those that were seen in the phase 3 Advocate trial. I think one ongoing, question among many is that there are ongoing questions about the duration of Avacopan use and the glucocorticoid regimen to use concomitantly along with it. And so these are really important areas of future study. One thing that our group is doing is we are expanding this cohort to include more individuals and to include longer periods of follow-up, so up to 2 years, in order to gather additional data to hopefully answer some of these really important remaining questions for the community.